Now we discuss a case of 65-year-old male who is a known case of carcinoma right lung, who came for a PET CT scan at staging in December, underwent chemotherapy and radiotherapy. Now he is being sent for a follow-up PET CT for response assessment of the treatment he has taken. This is the initial PET CT scan of this patient done in December 2021 at the time of staging. It shows physiological tracer uptake in the brain, as you can see, in the heart, liver and spleen, kidneys, urinary bladder, and some non-specific uptake in the bowel loops. Apart from this, the dark spot over here which is seen is the primary right lung malignancy with a few small mediastinal lymph nodes. After this staging PET CT, the patient undertook upfront chemotherapy and radiotherapy, and he came for a response assessment scan. This scan shows near complete resolution of metabolic activity in the primary lesion which we saw on the staging PET CT, and there is no other abnormal focal tracer uptake anywhere else in the body, which is suggestive of good response to treatment. And this also highlights the importance of timing of the PET CT scan. Now coming to the transaxials, as we can see, this was the initial primary lesion on the first PET CT at staging, which has almost completely resolved on the follow-up PET CT. And all the other foci which we are seeing over here with low grade tracer uptake could be secondary to radiotherapy, which will resolve with time. Apart from that, there is no abnormal focus anywhere else in the body in this patient. If only a CT scan had been done in this case for follow-up, it would have been reported as a residual lesion, as we are finding this lesion over here in the right lung at the site of primary. But if we can correlate with the PET CT images, there is no abnormal FDG uptake at all in this lesion which was seen on CT scan. That means this is all necrotic tissue with non-viable cells. In the absence of FDG uptake, this is all a non-viable tissue. This case highlights the importance of response assessment in cancers doing PET CT scan. This is a very good response in this patient with radical chemotherapy and radiotherapy. Even though there is a morphological lesion on the CT scan, since there is no uptake on the PET scan, it implies there is complete metabolic response in this patient.